कि अक्सर हम बेस कहते हैं जिस पे सेटल हो जाएगा कोई स्ट्रक्चर, लेकिन इससे पहले वी हैव स्टडीड दैट इट्स अ pyramidal structure. So it is like this. This is the apex. So this is the base. This is the base. This is the apex. So that is why this is called the base of the heart, or this is the posterior surface of the heart. Otherwise, when we put it in anatomical position, it should have been the inferior surface, should have been the base. But we earlier said that it is pyramidal in shape, having apex and base, so that makes the posterior surface the base of the heart. This is the apex of the heart. The next question is, tell something about the external features of the heart. In the external features of the heart, we see the chambers of the heart, then we see the surfaces of the heart, borders of the heart. First, chambers. This is right atrium, thin muscular. Above this is the superior vena cava opening into the right atrium. Just to left of it is the vessel coming from the left ventricle, that is ascending aorta. You can see it is a big vessel, elastic vessel, containing the large number of elastic fibers and tunica media. Then after next to it is the pulmonary trunk, again is a big vessel. But this is about the great vessels. Now you can see chambers. To the left of the right atrium is the right ventricle. You can see thickness of the muscle. This is very thin, this is thick. So this is ventricle. Then most left side is the left ventricle. Demarcation is this vessel, that passes along the anterior interventricular groove that divides the right ventricle from the left ventricle. So this forms the anterior surface of the heart, as it is against the sternum. So this is also called a sternocostal surface. So it's formed by right atrium, right ventricle and left ventricle. Then second surface of the heart is on which it is here resting. That is formed by right ventricle. This is the left ventricle and this is the right ventricle. So inferior surface or diaphragmatic surface is formed by two ventricles. So this completes the second surface. Third surface of heart is this posterior surface. It is formed by here this chamber. This is left atrium. कैसे पता चलेगा ये लेफ्ट एट्रियम है? इसमें 4 ओपनिंग्स होनी चाहिए फॉर 4 पल्मोनरी वेन्स. 2 हो गई, 3 और यहाँ से 4th. ठीक है, और भी स्मॉल वेन्स होते हैं. मेन 4 पल्मोनरी वेन्स जहाँ होनी चाहिए, तब ये हमें पता चलता है ये लेफ्ट एट्रियम है. एंड इट फॉर्म्स द पोस्टीरियर सरफेस ऑफ द हार्ट. देन some books may write this left lateral surface that is formed by the left ventricle. Coming to the borders of the heart, we have right border. From above downwards, it is formed by the superior vena cava that opens into the right atrium, and lower down should have been inferior vena cava that will form the right border of the heart. So this is also called the venous end of the heart, because these are all they collect the venous blood. Then this is right inferior border. Inferior border is formed by right atrium, right ventricle and left ventricle. Then left border by left ventricle. Superior border by left atrium and a portion of the right atrium. Superior. So this completes the borders, surfaces. Then we have some grooves. One groove is between the atrium and ventricle. That is called the atrioventricular groove or coronary sulcus, and that is present here. क्योंकि उसके आगे यहाँ पर पीछे तो आपको दिखेगा कोरोनरी सल्कस, जो पीछे की तरफ है दिस, और यहाँ पर एक वेसल है दिस इज कॉल्ड कोरोनरी साइनस. इट कंटेन्स, इट इज अ वेन ऑफ द हार्ट. Vein of the heart is not called the coronary vein, but coronary sinus. It's dilated, and it also opens into the right atrium. Posteriorly हमें दिख रहा है coronary sulcus, लेकिन anteriorly जब हम देखते हैं तो यहाँ तक तो आपको दिख रहा है, यहाँ पर भी दिख रहा है, लेकिन यहाँ आगे वेसल्स है तो वो इसको मास्क करते हैं। अदरवाइज ये है हमारा, ये जो है एट्रियम और ये है वेंट्रिकल, और बीच में जो भी सल्कस ऐसे आएगा दैट इज एट्रियो वेंट्रिकुलर सल्कस और कोरोनरी सल्कस, ठीक है। और ए बी ग्रूव। सेकेंड इज इंटरवेंट्रिकुलर, बिटवीन द राइट वेंट्रिकल एंड लेफ्ट वेंट्रिकल, इंटरवेंट्रिकुलर सल्कस। तो ऐसे वो दिखता नहीं है, मतलब कोई सल्कस है, ग्रूव है, लेकिन वहाँ से क्या पास होता है, एक आर्टरी, दैट इज कॉल्ड एंटीरियर इंटरवेंट्रिकुलर आर्टरी। सो दिस इज अ डिमार्केशन बिटवीन राइट वेंट्रिकल एंड लेफ्ट वेंट्रिकल। और ये कहाँ से आता है, ये लेफ्ट कोरोनरी आर्टरी का ब्रांच। Heart has two of coronary arteries, right coronary artery and left coronary artery. So it's a branch from the left coronary artery. Then after giving this branch, heart, right coronary and left coronary. Left coronary gives us this branch. This is called anterior descending because it descends, or anterior interventricular. Then the main branch of the heart continues as, that is called left circumflex artery, that supplies this area. On the right side we have the right coronary artery. Then after that, तो अब हमने देखा grooves भी, surfaces भी, borders भी. Now we have a look on chambers. One by one, this is the right atrium. And if you open it, if you open the right atrium, what we find while opening the atrium is that it has an area, some part of it is rough and some part it is smooth. Smooth part is called a sinus. Smooth part is because of the embryological origin of sinus venerum that is absorbed here, that forms the smooth part, posterior part, and rough part is here, and rough part resembles here the bristles of the comb. That's why it is called musculi pectinati. Musculi pectinati. Then after that you will see here down, it should open into the right ventricle through the tricuspid valve. So this is the atrial side of tricuspid valve. Then ये हो गया राइट एट्रियम, लेकिन इसका नेबर कौन है, लेफ्ट एट्रियम। ये इसका नेबर है लेफ्ट एट्रियम, और बीच में एक कॉमन वॉल है, दैट इज कॉल्ड इंटर एट्रियल सेप्टम। तो हम इंटर एट्रियल सेप्टम में क्या देखते हैं, एक डिप्रेशन है, ठीक है, दिस डिप्रेशन इज कॉल्ड फोसा ओवेलिस। देन फोसा ओवेलिस के ऊपर हम देखते हैं एक सिमरिंग जैसा स्ट्रक्चर, दैट इज कॉल्ड लिम्बस फोसा ओवेलिस, ठीक है। हो गए दो चीज़ें, ये आप याद रखेंगे। तो बाकी देन स्ट्रक्चर्स ओपनिंग इन राइट एट्रियम इज नाउ superior vena cava from above, inferior vena cava from below, then coronary sinus is the vein of the heart, then some veins from the different chambers of the heart, they open into the right atrium. Then left atrium, if we open it, this is that left atrium, we have cut it like this and we open it, then what we see, smooth, it is smooth. Left atrium is smooth, so nothing to discuss about it, no important structure is present in it. Then you will see the ventricle. This is the right ventricle. When we open the right ventricle, what we see, the muscles, muscular ridges. These are called trabeculae carni. As well as we see the papillary muscles. Papillary muscles are finger-like muscles having the papilla tip. From the tip is attached a tendinous structure called chorda tendini, which on the one hand is attached to the papilla, on the other hand is attached to the valve, tricuspid valve. So left ventricle also has a similar structure. You can see here the papillary muscles with chorda tendini in the left ventricle as well. You can see here, and these are attached to the cuspus of the this bicuspid valve. Then we have in superior vena cava. When we open the superior vena cava, what do we see? When the left ventricle contracts, it ejects the blood into the just ascending aorta. Then, but some portion of the blood comes back. Not whole of the blood goes into the ascending aorta. Some blood gushes back, and that is taken by the valves, semilunar valves, and they are present here, and they get filled and closes what can we say, this left ventricle. You can see here these valves here. You can see here the valves. दिख रहा है भाई? सेमिलुनर. तो फिर एक और पॉइंट हम देखते हैं. देखो ये हो गया. ये क्या है? ये वेसल्स है. ये है बिग वेसल्स. ये आर्टीरियल एंड है हार्ट का. जब हार्ट का डेवलपमेंट आप पढ़ेंगे, venous end, one is arterial end. This is the arterial end, and this is the venous end, because it contains superior vena cava, pulmonary veins. So this is venous end. In between the two, there is a space that is called sinus, sinus. This sinus is called transverse sinus. It's called a transverse sinus. It is in space between the arterial end and venous end of the heart. Then there is another sinus which is present behind the left atrium. This is called oblique sinus. This is called oblique sinus. So we have two sinuses as well. So read it and add to your knowledge.